The positivity rate for COVID cases in St. Vincent and the Grenadines has been increasing since that explosive eruption of the La Soufrière volcano back in April. Now that's according to the chief medical officer. She said because people were placed in confined spaces, they did not adhere and maybe were not able to adhere to physical distancing protocols. Speaking on NBC Radio, the chief medical officer said the positivity rate has now more than doubled.
So on April 9th, when the volcano erupted, just before that, we were seeing positivity rates, meaning the number of positive tests when you run a batch of tests. So the percentage of positive tests. We were down to 1%, 2%, 3% would have been a higher number. Since the volcano erupted and a seeming lack of awareness, not awareness, I wouldn't say awareness, but willingness, maybe capacity to comply, because we know that social distance, physical distancing became a problem. A lot of persons were in small spaces close together, even as the matter of persons lining up to go to Western Union or, go into a bank or whatever. A lot more persons were concentrated in a much smaller space. We noticed that persons weren't wearing masks, or not wearing them at all, or not wearing them properly. And since then, our positivity rates have been climbing and climbing rapidly. So we are always around 4%, 5%, 6%.
And according to the latest COVID-19 statistics, there are 226 active cases in St. Vincent and the Grenadines. Over 2,000 cases have been recorded since the first case was confirmed in the country back in March of 2020. So far, 12 people have died from the virus.